You're watching Hope and Courage, a tribute to breast health on ABC 27, presented by Penn State Milton S. Hershey Medical Center.
Welcome back. Dr. Leah Cream now joins us. And doctor, from what I understand, there are more than one type of breast cancer. What are the types? What are the different types? I didn't know that.
There's several different types. There are non-invasive breast cancers, which are sort of pre-cancers. There are different types of invasive breast cancers. There are inflammatory breast cancers, which involve the skin. And each type is treated slightly differently. So I tell all my patients that their breast cancer is different than the patient in the next room.
We've been talking about all the progress that's been made in this fight against this terrible disease. What new treatments are available now to fight breast cancer?
It's very exciting. There's almost a new treatment for breast cancer every several months. That's how fast the research is moving. And we can individualize the treatment to a very high degree now, so that each patient has very specialized treatment based on their type of tumor. So some patients get anti-estrogen therapy, some patients don't, some patients get chemotherapy, some patients don't. It varies widely.
That's why the title, Hope and Courage, is working out that way. Let's go back to the call center for the final time. Deborah?
Okay, Chuck, we do have time for one more viewer question. I've heard men can get breast cancer. How common is it for a man to get breast cancer, and what's the best way for a man to check?
Actually, breast cancer in men occurs less than 1% of the time. A man typically would find a lump during a shower and so forth, and then would need to see his physician just like a woman would.
Okay, great. Thanks so much, Michelle, for joining us this evening. And we want to thank all of the professionals here who are busy answering the telephone calls. And we want to thank you at home, too, for calling us with these questions. And we hope we've answered them for you this evening. Back to you, Chuck.
Thank you, Deborah. And I know there are a lot of phone calls coming in there. And the questions can't all be answered. They can contact your center, and we can take it from there. Sounds like you have a lot of options coming up there for all the people.
Absolutely. And mainly what we want to tell people is not to be afraid to get their mammogram. You know, the worst thing is to let a breast cancer go undetected or go into its later stages. When these things are caught early, they're curable, and there's many options.
All right. And again, if you would like to schedule a screening mammogram, call 1-800-243-1455, or you can go to their website at pennstatehershey.org/breast. You can call anytime. They're open 24 hours a day. Doctor, just one final question there. Preventative. Is there anything, we talked about what happens. Can we prevent this? Is there something a woman can do, a man can do to prevent this?
Yes, and that's another area that we're working hard on in breast cancer. Of course, we have a lot of treatments to offer patients with cancer, but ultimately we'd prefer that nobody ever got breast cancer. And the ways we can do that, besides screening and healthy lifestyle, is that there are actually medications that can be used. So certain patients that are very high risk, that maybe have a lot of breast cancer in their family or have had previous biopsies, there are medications available that they can take, pills for 5 years, that can reduce their chance of breast cancer.
A lot of optimism after this show. All the things we've talked about here tonight with all the doctors. Thank you for joining us here tonight. And that's all the time we have. Thank you for joining us tonight. Take care.